I'm Peter Dumo. Welcome to the chapter, Documentation in the World of Expanded Scope. Upon completion of this module, you will be able to describe documentation in daily practice, describe the differences in documenting distributive versus cognitive activities, describe strategies to routinely integrate documentation. Let's take a look at a patient case to better illustrate this.
Hi there, how can I help you?
Hi, I just flew in from Thunder Bay for my niece's wedding. I packed all my medications in my baggage and the airline lost it. They have no idea where it is or when they can get it back to me. And I don't know what to do.
Well, this is not a great way to start your weekend. I'm so sorry that's happened to you. Would you happen to have a list of your medications with you at all? Oh, that is great. I see that here. And your name is Mel Brown. You're Mr. Brown?
Yep.
Okay, well, this is very helpful. It's a great starting point. I will have to contact your doctor or your pharmacy. Would you happen to have their contact information?
Oh, well, I can tell you their names.
Okay, yep, then I can look it up for you.
Sure.
Okay, go ahead.
Miller Pharmacy in Thunder Bay.
Okay.
And Dr. Stephen Varney, V-A-R-N-E-Y.
Great. Okay, what I'm going to do is I'm going to try to contact them, and so if you can just stay close by, I'll let you know what happens.
Yes.
Mr. Brown, the pharmacy's closed until 10 o'clock tomorrow morning.
This situation requires good history taking and extensive documentation. It also requires follow-up. Before looking at how to proceed in a situation like this, ask yourself these questions. What are some key differences between distributive documentation and expanded scope services documentation, which is often shared with other healthcare professionals? When should the pharmacist communicate the provision of expanded scope services to other healthcare professionals? And how much documentation is required for different levels of service? What are the differences between distributive and expanded scope documentation? Most documentation that takes place within a pharmacy is related to either a prescription or to inventory reconciliation. When it comes to prescriptions, a pharmacist signs off on the following on the hard copy: that the prescription was filled correctly, whether or not counseling was provided, if there were drug or disease interactions and how they were addressed, and appropriateness of drug therapy, including drug strength, directions, day supply, early fill or late fill issues. The vast majority of current documentation with the pharmacy is focused on distribution. We will sign off that counseling was provided, but not necessarily what was said, even though we often communicate a lot of clinically relevant information. In general, few prescriptions have clinical encounters documented clearly, and when they are documented, it is usually on the back of the hard copy of the prescription. These are then filed away. If one looks at a hard copy, there's very little room for any kind of significant documentation of cognitive services. With expanded scope and new clinical services, our approach to documentation will need to change. We will require more documentation. We will also need to provide different types of documentation. We will be able to retrieve documentation readily, and we have to be able to communicate and disseminate this information with other providers. Examples of new documentation include adaptations, renewals, administration of vaccines, smoking cessation, medication reviews, and clinical recommendations, for example, pharmaceutical opinions. A comprehensive medication review requires detailed documentation regarding all medications an individual is taking, how they are taking them, when they take them, how long they've been taking them, and even what their experience taking each medication has been. The MedCheck program is an example of an Ontario Drug Benefit Medication Review program that has evolving needs for documentation. In fact, the documentation requirements have recently changed, and now it requires that all medications include directions, how the patient is taking it, the strength, the dosage form, date of last fill, and quantity last filled to be clearly documented. These documentation requirements have been established by the Ministry of Health and Long-Term Care and must be met. Additionally, for a home meds check, you should document why are you going to the patient's home for the medication review. The med check documents need to have a page number, for example, 1 of 1 or 1 of 2, and they must have the meds check header and or footer, and they need to have a disclaimer explaining what the med check program is. Ontario Drug Benefit does audit cognitive service provision for patients covered under their programs. Hence, it is important to clearly record all aspects of the encounter. During audits, many things are reviewed. However, it is very important that it is clear that a service was provided to a patient and that any clearly specified documentation requirements are met. In order to assess if a service occurred, auditors may do telephone calls or send mailings to patients to ask about the services they received. They may also look for a signature on the meds check form. Auditors also look for technical aspects of the service and need to ensure all specified requirements are met. It is important that you document everything that is specified. Did this service happen? Technical aspects of the service or date last filled, quantity filled. When it comes to adaptation and renewal, the Ontario College of Pharmacists has a very nice template that is accessible online. However, some may find the template onerous and time-consuming to fill out. I've always found it better in practice to document why you are adapting or renewing the prescription on the back of the prescription itself using bullet points, specifically 1 line each. What did you do? Why did you do it? And how will it help the patient? Let's go back to our patient's case. Remember, we have a patient who's from out of town who has lost his meds on a flight. He does have a list, but it is incomplete. The case requires renewals and adaptations. Both his hometown pharmacy and his doctor's office are closed. This requires good history and extensive documentation. It also requires follow-up.
Okay, Mr. Brown, thanks for joining me in the counseling room here. So we're going to begin our consultation. I'm going to just get some background information from you. So it's Mel Brown, and your date of birth is?
February 5th, 1950.
Okay. And are you a smoker?
Quit a couple of years before my heart attack. Yeah.
Great. And any allergies to medications?
Not that I'm aware of, no.
Okay, perfect. So let's begin looking at your prescription medication. So you've got metoprolol, 50 milligrams BID. Do you know which one that is that I'm talking about?
Yep, well,
Yeah.
yeah.
And would you take it when? Twice a day?
Morning and with breakfast, and then evening with dinner.
Supper or
Yeah.
the bedtime? So
Yeah.
breakfast and supper. Okay, very good. And do you know what that one's for?
That is for my blood pressure. Yeah,
Correct. Good. All right. That is correct. And so then we have the warfarin. You've got here that you're on 3 milligrams. Now that can vacillate, but
Yeah.
you've been on 3 milligrams for a while.
Yeah, my INR's been steady for a long time. Yeah.
Okay,
Yeah.
great. Well, based on that, I think that we've got a very good and accurate, up-to-date medication list based on this list and what you've told me. So what I'd like to do is renew all your prescriptions for 7 days. And this way, that'll be enough to carry you through the weekend, through the wedding while you're here, and in the event that they don't find your luggage, it'll carry you till you're back to Thunder Bay. Does that make sense?
Yes, great.
Okay,
Thanks.
perfect. So it's going to take us a little while, about 30 minutes or so, to prepare the prescriptions. So you're welcome to take a seat in the waiting area and sit down and relax, or if you'd like to browse through the pharmacy, that'd be great too. But we'll come and find you. We'll call your name when the prescriptions are ready.
Great.
Great, thank you.
Thank you.
Iris,
Yes.
the Diamicron MR60 is back ordered. What do you want me to do?
Oh, that's right. Yeah, I guess I'm going to have to change that. Let's modify the renewal to glycoside 30 milligrams. So glycoside MR 30 milligrams, take 4 tablets daily, and I'm going to let the patient know about that. Thanks. Okay. Thank you for your patience. So we're all set and ready to go. I'd like to go over your medications one more time. I've got them in the bag, so I've got a couple of them here. So here's the first one, and as you can see, I've got the label there, and you take it as required, only when you need it, so not every single day. And that's what it looks like, right? Yeah. All right, good. And I'm just going to document that there. And we have this one. The one that you take for sleep, right? That's correct. You're familiar with that one, right? And I've got the instructions there. That's correct.
Great.
Perfect. I wanted to let you know that your Diamicron MR 60 milligrams, it's back ordered. And but the good news is we have something very, very similar, and it's called gliclazide MR, but this is a 30 milligram tablet. And so rather than taking 2 of the 60 milligram tablets, we're going to ask you to take 4 of the 30 milligrams. And this is what they look like. Right? And so hopefully that's okay with you. It gets you the dose that you need.
No problem. I've been on those before.
Okay, great. Well, that's perfect. So what I'd like to do is spend the next few minutes talking about traveling with medication, just to go over some tips and strategies for your next trip.
My wife used to take care of all this stuff. I never used to have to pay attention to it. Ever since she passed away, it's been pretty rough. That's why I'm on the paroxetine.
I'm so sorry to hear about your wife, and you know what, it must be very difficult for you to take on these new responsibilities and the challenges that come with it. And so to that point, I wanted to ask you, did you by any chance pack your blood glucose meter and your test strips in your luggage?
Oh, yes.
I thought that might be the case. If I renew your prescription for your test strips, they won't be covered by your drug plan, and you'll have to pay the fee for a whole new box with the 2 bottles. But the good news is I can provide you with a brand new blood glucose meter free of charge, and it's covered by the company. In this kit, you'll get some sample lancets and a little bottle of 10 test strips, and that will more than cover you for your time spent here until you get back to Thunder Bay. Does that work for you?
Yes, great. Thanks.
Okay, perfect. Let's spend a few minutes. I'd like to go over the blood glucose meter with you just to make sure that you're going to use it appropriately and that you're comfortable with it.
Super.
Okay, great. Mr. Brown, we're almost done. So I have some documents here, and the first one is called a meds check, and among other things, it has a list of your medications, and it's based on your list that you had in your pocket and our conversation here. And so what I need now is you just to sign. We need to document our interaction, our appointment today. So I need your signature right there, if you don't mind. You can see I've signed it as well. Okay, and also I need a signature there, and this just authorizes the fact that you're giving me consent to renew your prescriptions and that we made the change from the Diamicron 60 to the gliclazide 30. All right, and here's your copy. I have a copy for you, and you know what, share that with anyone involved in your healthcare, and you know what, make it part of your travel documents next time you go on a trip. It'll come in handy.
Thank you for all your help. I had no idea a pharmacist could do all these things. You've been a real lifesaver.
Well, thank you for that, and it was my pleasure to help you out in this situation. Have a great time at the wedding tonight. Okay,
Thanks.
Take care. Hey, hi Matthew, how are you?
I'm well. I hope you can help me with that.
In our case, which of the following will the pharmacist have to adequately document? A, the rationale for extending the prescription. B, the rationale for pharmacist-decided meds check. C, the rationale for adaptation of gliclazide. Or D, all of the above. The answer is D, all of the above. In this case, the pharmacist would have to adequately document all of the options. Let's look at the documentation needs for different services. For the influenza vaccine program, we obviously need to document consent. We also need to document lot numbers and dates of administration for the vaccine. We need to maintain fridge records, including a temperature log. And we need to maintain on-hand pharmacist proof that they are CPR certified and first aid certified, and that they have completed an accredited vaccination education program. In regards to smoking cessation, Ontario Drug Benefits actually has a very extensive template. Although the template looks very onerous and time-consuming, it is actually a very good guide in terms of providing proper smoking cessation services. Familiarize yourself with this template. It will guide the patient visit. When documenting a pharmaceutical opinion, it's important to communicate properly with the physician. You have to state the problem, state possible consequences, and provide a recommendation. This is key. Without providing a recommendation on a pharmaceutical opinion, you are not really giving an opinion. This is not reimbursable. So always use the term suggest, consider, recommend, etc. Do not leave all the choices up to the physician. Provide that physician with a clear recommendation. For example, you get a prescription for amlodipine 10 milligrams daily. However, the patient has always been on 5 milligrams daily. The patient confirms that the physician did not mention any change in their treatment. When faxing, the format should be as follows. Dear Dr. Smith, your patient, Mrs. Smith, presented a prescription for amlodipine 10 milligrams daily. Patient has always been on 5 milligrams daily and denies any changes. Suggest changing to 5 milligrams daily unless the dose increase is warranted in order to avoid hypotension and an increase in peripheral edema. Thanks, John Doe, pharmacist. When one looks at this fax, you'll see that we've described this scenario. A prescription for amlodipine 10 milligrams and the patient was on 5 milligrams. We've included a suggestion and why we are making that suggestion, because we want to avoid hypotension and an increase in peripheral edema. This meets the criteria for a pharmaceutical opinion and is just a reasonable recommendation all around. When and what should you communicate when providing advanced scope services? In our case, which of the following communications is most important? A. Renewal of multiple medications and informing the physician. B. Adaptation of diimacron MR60 to glycoside MR30. Or C. Following up with the patient's pharmacist the next morning. In this case, the answer is C. Since there are doubts about the patient's medications, communicating with that home-based pharmacist is the most important communication. When documenting specific practices, services, or programs within your own pharmacy, it is a great idea to create a template for your practice. Use a simple document in Word, OpenOffice, or any other word processing program to create a template. Make it so that it is small enough to file away with the hard copy of the prescription. Make 50 copies of this, then pilot it. Once you've got the right document with the right content on it, take it to a printer. It's much cheaper, cost-effective, and time-effective to go to a printer and get a couple thousand of these printed off rather than just copying it off your own printer. When we think about documentation, one of the main things we get concerned about is, what will the college say? Well, the reality is the Ontario College of Pharmacists is not interested in harassing you or giving pharmacists a hard time. Their primary concern is that the patient's best interest is being served. So when documenting, include this in your documentation. When appropriate, communicate with the physician. Smoking cessation, renewals, and some adaptations can also be communicated, but pharmaceutical opinions must be communicated. And always include how your service will benefit the patient. When documenting more advanced services, it can be tough to figure out how and what to document. This depends largely on what kind of services you're providing and what another clinician wants to know. It's probably a good idea to talk to the other clinicians that you're working with, what they want in terms of documentation, and follow through on that. Organize your document in such a way that the key information pops off the page. Whether that is bolding, positioning, font, etc., make it easy for the clinician. And after visits, fax the copy to the relevant clinicians within the circle of care. This sharing information chart gives you some good advice that you can use in practice. Storing and retrieving these documents needs to be made very efficient. Scanning with off-site backup is an excellent idea in terms of documentation of clinical or even just regular prescriptions. Cloud-based storage is a useful format if you're documenting more advanced clinical services. We at NovaCare use 3 different formats: cloud-based storage, on-site storage, inside the computer, and we also use paper charts for everyone where a copy of the last visit is kept. There are confidentiality concerns with all these formats of storage. Rest assured, there is no form of electronic storage that is 100% safe. There are no standards set on that. It is your responsibility to make sure that the documents are stored as safely as possible. Let's reflect on the patient case. Would you be able to provide the service and documentation with the resources you have at hand? Why or why not? In order to provide the services and carry out the documentation in this case, what are the key resources that you need? Would the pharmacist have been within his rights to just send the patient to the emergency room? When it comes to documenting different levels of service, a different approach makes sense. For the sake of practicality, I'm dividing up types of services being offered in community pharmacies into 3 levels: level 1, level 2, and level 3. These are very rough categories, and they do not include counseling, as that is a different ball of wax altogether. When we are talking about level 1 services, these have very little decision making involved, require maybe 5 to 10 minutes, and there's little patient education, there's some documentation, and little to no physician communication. And the staffing model is best suited for a solo practicing pharmacist. An example would be a flu vaccine administration or adaptation of a prescription. A level 2 service requires some decision making. The time requirement can be anywhere from 5 to 15 minutes, and there is some patient education involved. Documentation is limited, and physician communication does occur. The staffing model will likely require an overlap pharmacist. An example would be extending a prescription or doing certain adaptations to prescriptions. A level 3 service requires some or significant amount of decision making. The time requirement can be anywhere from 10 to 40 minutes, and the amount of patient education, documentation, and physician communication is significant. This staffing model requires appointments. Examples of these level 3 services include diabetes management, diabetes education, anticoagulation management, travel medication consultation, or conducting a proper meds check. For level 1 services, documenting on the hard copy can be minimal, and there is little need to communicate this information to the physician. That's pretty simple. Level 2 services can be either on hard copy or on a small form that you've developed in your own practice setting that meets your needs. There's a medium amount of documentation, and sometimes you're going to need to communicate this to the physician. Level 3 services should be structured like a progress note that a consultant would send off to the family doctor. It's a good idea to make an electronic template with Word, WordPerfect, or whatever format you're using, and this should be forwarded to the physician after each visit. Documentation is a key concept to accept as we move into a more advanced clinical services, more cognitive-based services, and more professional services. And remember, if you didn't document it, you didn't do it.